Right. Wow. Good afternoon, everybody, and thanks for joining the 340B Advocacy Works webinar. I'm Colleen DeClaudio, President and founder of 340 Basics and a proud board member of Community Voices 340B. I am very excited to moderate this webinar and share the details of how advocacy can work and make a big impact. I worked in FQHCs for about 15 years, and I know firsthand how important advocacy is to mission-driven nonprofits. We do have a full agenda, so in a second, I'll hand it over to Peggy Ty from Powers Law Firm. If you have questions throughout the webinar, feel free to drop them in the question module queue. You should see it on the right-hand side of the screen. And thanks for joining. I hope you are able to gain some useful insights into how to help build your advocacy efforts to support the 340B program. So with that, Peggy, I'm going to hand it over to you to kick us off.
Great. Thank you very much, Colleen. And I will just stop to thank Colleen because this was her brilliant idea of why don't we get together and talk about what happened in New York and how we were able to fight back a pretty ugly proposal that would have harmed the 340B program. So I am Peggy Ty at Powers Law Firm. I represent as legislative counsel to Ryan White Clinics for 340B Access. And I also work very closely with Community Voices for 340B. Community Voices is a grassroots organization that is looking to form a groundswell of grassroots voices in protecting and defending the 340B program. So what we're bringing you here today is, as suggested by the title, is the New York story. I wish I could have had everybody who participated in the New York coalition and what I consider a very excellent fight in New York with a good result on this call, but we wanted to limit it to just a couple participants. So you will hear from three of some of the main leaders in that coalition and joint coordinated campaign working to fight against the carve-out in New York State. So next slide, I will do a rundown of the agenda, and then I'm going to give you a little bit of a snippet on each of our participant panelists. So what we're going to talk about today is, of course, that state Medicaid carve-out proposal, give you some history and backstory, how it was rolled out, the involvement of a stakeholder group or lack thereof, state legislative action and reaction. We're going to dive into what the coordinated campaign was, how it came together, who was involved in that coordinated campaign, and talk about RWC 340B's role in particular, and also a group that coalesced around this one issue, the Save New York Safety Net organization, and other key allies with whom we worked. Then we'll move on to what we think are key actions and lessons learned in that year-long fight that we all went through together, because we think it's important for other states who are potentially going to advance a carve-out to know how to fight back. And what we found effective and useful in the state of New York might actually be effective and useful in your states as well. We'll talk specifically about PR and earned media and lobbying and all those things towards the end. And then we're going to talk about what do we do next. So you're only a success on your last victory until the next day when you have to figure out what you're doing next. So it's really important to also talk about next steps. So we're fortunate enough today to have this excellent group of panelists, starting with Mark Malachowski from Trillium Health. He is one of our executive committee members for RWC 340B. Also from RWC 340B is Mike Lee from Evergreen, both proud New Yorkers in the upstate area. And we are thrilled to be joined by Kimberly Smith from Callan Lord, who is not in upstate. In fact, she was just talking about Bed-Stuy. So Kimberly was one of the lead organizers in the work that Save New York Safety Net did, again, along with a bunch of others. But Kimberly was really a driving force and a coordinator and organizer and activist in a lot of work that we did. And you know me. So moving on, the format for this presentation is that we have put together an outline of what happened in New York, and then we've put on the slides a bunch of questions, and we're going to do a fireside chat and we're all going to chime in about our various perspectives of what happened in New York and what could be happening next. So I think at this point, I'm going to turn this over to, I believe, Kimberly. You were going to start us off and then have Mike and Mark weigh in about, oh, I'm sorry, Mark was going to start us off about what happened in New York. So in May, governor's budget, this came out of the blue, and what happened, Mark?
Yeah, it was actually April of last year. The governor and the state was in the middle of the COVID fight. And in New York, the governor has some extensive power anyways in the budgeting process. But at that time, dealing with COVID and him being kind of a national darling on the issue, if you will, he was profoundly powerful in putting forth his budget proposal. And part of that was to try to move the Medicaid managed care benefit back to fee-for-service, which in essence would do two things. For one, it would increase the state's ability to collect rebates, but also it would decimate the ability for covered entities to access the 340B. We had some friends in the legislature that realized the danger to covered entities, and so they were able to get a 1-year delay on the implementation of this carve-out, which basically gave us, 365 days to come up with something to prevent from moving forward in April of this
year. Okay.
And I think I hand here to Kimberly to talk about the creation of the Save New York Safety Net.
Sure. Hi, thank you for having me. Thank you to RWC 340B, to Community Voices. Thank you, Peggy. So I think I'm going to just repeat a little bit of what Mark said and then kind of go into the coalition. But the plan to carve out the Medicaid pharmacy benefit from Medicaid managed care to fee-for-service came through last year's state budget. We have a fiscal year that runs from April 1st to March 31st, and a lot of the budget advocacy happens from January through March. And so this proposal was adopted through the state budget of FY21. It didn't just magically appear in the state budget, of course. It was put forth originally by our Medicaid redesign team, the second iteration of our Medicaid redesign team, which was formed essentially to find savings in the Medicaid program. This was not the first time we did that either. The governor and the state formed a Medicaid redesign team in 2011, and then did it again in 2020. So the Medicaid redesign 2 was formed in January, I think, January or February of 2020, and they met a couple times. There was a lot of hubbub in the advocates and public health and healthcare communities because the process didn't seem very transparent. It was very rushed. So we were sort of already primed to hear from them that there would be proposed cuts. So that team put forth this proposal in their final recommendations, which were released, I think, in March of 2020. Right, of course, as the COVID pandemic was really raging in New York, we, of course, were hit hard early and continue to be hit hard. So there was a little bit of advocacy that happened to try to prevent the pharmacy carve-out proposal from getting into the final budget, but it kind of got swallowed up in the COVID pandemic, and so it passed in the budget. There was the implementation of the carve-out, as Mark said, was set to happen on April 1st of this year, 2021, and the language in the budget did include language that stated that there was going to be a 340B work group established to try to look at the impact of the pharmacy carve-out on 340B. It was a non-binding work group. It was set to meet a few times. So we immediately set about to try to figure out how we were going to influence that. work group. So that's kind of how the plan got put forth. The context was, you know, the COVID pandemic and its devastation in New York and across the country. Governor Cuomo also was empowered through the budget with these superpowers, and you know, he had these powers to make further cuts to health and social services and human services, should he want to. But it was kind of a big mess from the beginning. It passed, it kind of got tucked away, and then the advocates had to figure out how to fix it. So.
Well, thank you, Kimberly. If we move to the next slide, I want to ask you all two questions. One is that the price tag, if you will, or the savings that was coming to the state, a big part of why the state was pushing this, especially thinking that COVID was and is devastating to the state of New York. And then what was the opportunity, and I put that in quotes, to participate as stakeholders in communicating back with the governor's office and MRT to talk about what we thought this was going to do to the safety net. So who wants to start with the cost impetus? And then Mike, I think you're the right guy to talk about the stakeholder group or the work or the group. Or maybe I've said enough. So what the idea, go ahead, Mike.
Can you hear me?
You know, I can definitely talk to the stakeholder group. You know, a part of Kimberly's point was that as part of the budget, the governor convened a 340B advisory group, which was supposed to put forward non-binding recommendations about the carve out. I think in total we met maybe 3 times, and each, you know, the first meeting, we got the PowerPoints, you know, I think like 30 PowerPoint slides, you know, 20 minutes before the meeting, you know, going over some questionable data. And the group wasn't allowed to sort of go outside of, the state had put aside this pool of $102 million, which they thought would be enough to cover all the covered entities, 340B losses in the state. So when we got this group together, instead of making recommendations about, you know, ways to save money or you know, save resources across the state or different, you know, I guess recommendations, we were only allowed to focus on what mechanism we could come up with to distribute this pot of $102 million. And I would say one thing about the $102 million is it's woefully inadequate to make all the covered entities across the state whole. I know just to Evergreen alone, you know, we were talking upwards of, you know, a $12 million impact on the resources that we were generating for our safety net population. So of course, if you extrapolate that across the state, it was not going to make all the covered entities whole. And anyway, long story short, with the group, you know, we had a couple of meetings. We couldn't make any input, and we refused, the group where there was a subgroup of us, all of the safety net providers refused to make a recommendation to come up with a mechanism to split up this pot of money, because we thought it would be, you know, sort of, we're just chopping our legs off, you know, ourselves. So designing our own execution chamber, I think somebody put it. So so we refused to participate in that way.
So taking us back to our, we can,
Feedback, Peggy.
taking us back to our questions, the political dynamics at the time, Mark, I think you mentioned, so we're right in the middle of COVID. They're in a rush to finish the budget before everybody goes away, and there's no legislative session and nobody knows what's happening next. They're probably thinking they're going to have to save some money. This proposal was attractive because the numbers they had, the economics analysis that they did, seemed to propose all this money. How did we all fight back against that proposal, where Mike had just described to us, for example, they didn't seem to be really listening? So what activities were taken on, reports or research or otherwise, that helped fight that back?
Yeah, so we immediately, very early on, we had a discussion with the national organization, RWC 340B, that we needed some data that was going to be supporting our position that that anytime resources are taken away from the covered entity community, it's going to lead to poorer health outcomes. So RWC 340 entered into an agreement with a company called Advocacy to do an analysis, and that analysis is actually available on our website, RWC 340B's website. And it going into it, we're confident that the data that they were collecting what we've talked about for years, having together 340B program, we couldn't have asked for a better outcome. I mean, they clearly were able to make the case that, look, you remove resources from, and it was looking particularly at Ryan White clinics. You remove resources from Ryan White clinics, you're going to see poorer health outcomes, and specific to the viral suppression. So we use this to go back to the state and say, look, this is the classic wise foolish. You're going to be having to pay out more patients, potentially with HIV, that you're going to have to provide care for. So that was part of really part of the national strategy RWC 40B using to employ in what was really just a state issue, but we saw this as having much implications across.
Thank you, Mark. Your audio is coming out a little choppy. If there's anything you can change on that. So we had talked about the RWC did this analysis, but there were also, Kimberly, remind me, it was the Menzies study. There were other groups that were putting out counters to the state's analyses about this, right?
Correct. I mean, early on, the Ending the Epidemic Coalition was one of the main sort of central coalitions to really kind of get activated on this issue early. And we had discussions with the Department of Health, with our friends at the Department of Health in the AIDS Institute, who very bluntly told us, you're going to have to make your case and really try to sort of help us understand what this is going to cost and what the impact will be. And so the Ending the Epidemic Coalition did its own very small survey, not as super rigorous as maybe the Menzies report, but we did survey groups that are in the Ending Epidemic Coalition, which include FQHCs and Ryan White care providers, to figure out sort of how much they stood to lose just revenue-wise and what the impact on our services would be. And I think we determined that among those surveyed, we would lose $56.1 million. And so these studies were kind of coming out sort of one after another. This didn't happen until more towards the end of the summer and into the fall, but really sort of building the case against what the state was saying in terms of how much savings they claimed they were going to get. Another thing that I wanted to make sure to mention is one of the things that the state was attempting to do was to get this, what they thought was going to be complete visibility into the underlying costs of prescription drugs and this transparency into this. And our point was, well, we've been transparent all along. We can tell you how important this revenue and these savings are. You haven't really asked, but we can get that information to you. We also asked when we formed the, I'm probably jumping around a little bit, but the ET coalition was already an existing coalition when we formed around the notion of ending the AIDS epidemic in New York State by 2020. And so there's a broader coalition that would meet periodically, but legislative and advocacy committee that met every other week. That's been meeting every other week for 5 years now. And so we formed out of that group a 340B work group. And that is where we really started to gain momentum. And I had personally, I know that we have Ryan White care providers in our midst, but I'd never worked with the Ryan White Care 340B coalition. And somehow you all found us, you all were doing your work, and we just kind of folded together and grew. And others across the state that were not HIV providers specifically started to learn about what we were doing. And we asked groups in the summer really to go back to their clinics or organizations and, if possible, create their own impact statements about what how the 340B savings was used in their organizations and what it pays for, and how important the services it subsidizes are for the patients and clients. And so I don't know in the end how many of us did that, but I think a lot. And I think that also helped to kind of, for us also to just sort of strengthen those muscles to talk about 340B and the relationship to the pharmacy carve out, and talk about why it's so important, and really make the case to the state.
Yeah, I'm remembering back those early calls. There were maybe 10 or 15 people on them. And then by the end of this debate, it was 3 pages of Zoom. So many people jumped in to be helpful. It was really, really cool seeing that evolution.
Mark and Peggy, maybe you can speak to a little bit, New York is a leader in this country, and a lot of times a lot of other states follow suit. So do you have some insight in how, if this went through and was approved, how it would have impacted maybe other states and have had a national impact if the carve out was approved? Mark, I think you're on.
Mark is on mute. Mark has brilliant things to say, I promise. We just can't.
Nope.
We can't hear you.
Sorry.
How about now?
Nope,
Yeah.
now we got you.
Yeah, we got you.
There's 2 mute buttons. Okay. Yeah, I mean, it absolutely, we saw national implications on this. California was doing something similar. And so, we're thinking, geez, at the national level, if New York and California does this, what's to keep other states from following suit? So while it was very personal to me and Mike being in New York and affecting our organizations directly, as being members of the executive committee of RWC 340B, we saw this spreading across the country. And so felt that we needed to end it in New York, certainly for us and our clinics and organizations, but also to ensure that it doesn't create a stand across the country.
Right. So speaking of California, throughout this debate, this campaign, if you will, in the last year, we've always been touching base routinely with our California colleagues. There's litigation with some groups in California against the carve out that is supposed to happen there. I just talked to somebody from California today who said nothing will happen before July is the latest news they're hearing. For some of you who don't know, there was a stall on California instituting their carve out in a conflict of interest situation with Magellan and Centene. So the state is analyzing if they can get over that conflict of interest or somehow resolve that conflict of interest before they would move forward with the carve out proposal. In the meantime, I think it's been great to share literally across the country all the things we're doing in New York and try to arm them, and for them also to send us back information to help us fight a good fight in New York. Anything else about California? Anybody else wants to add to that? Or we could go further into what we did.
Yeah, I think we can go ahead.
Okay.
Next slide. So let's talk a little bit about how this all came together and some of the key stakeholders. Kimberly, why don't you shed a little light on how that all started?
Sure. So as I mentioned, I am quite certain that, all of us were in our corners in New York State, really panicking when this went through. And from my vantage point, Callan Lord was early in the mix and reached out to our friends and allies at Housing Works, who we've worked with for a number of years. And if those of you who know Housing Works, they're housing services and aid service organization, and they have a very strong activism and advocacy apparatus. So we activated them early and activated the ETE coalition early, and really did have to do some education, as you know, and learn, but more specifically how this was going to really impact us all. And then, you know, we quickly, as I mentioned, grew, and RWC 340B came into the mix. Many other organizations came into the mix. Over the summer, we started, each group that kind of would come in would invite others, behavioral health, substance use clinics who are also impacted. I would say there were, you know, it was, you know, there are a few sort of unlikely bedfellows, although they weren't like actively involved in the Save New York Safety Net Coalition, the health plans. You know, we were aligned with them. Of course, we work all the time with ImmediaCare, which is one of the HIV special needs plans here in New York State, and they were very important in all of this. And I will say our State Primary Care Association was very active early on, and very much involved, and we were aligned in terms of making sure we stopped this thing. And then we sort of eventually, we just kind of kept growing and growing. Towards the end, or in the middle, I'm not sure, we were able to involve some of our unions, 1199, some larger organizations like Planned Parenthood in New York. I'm going to talk a little bit, or we might get to a little bit later, just about how we sort of were able to engage faith leaders and civic leaders and organizations as well. So I think we were all sort of united with a sort of sense of urgency around this, about the carve out. And while it kind of looked different for each of us, the impact, I think we were definitely sort of cohesive in terms of what was at stake, cumulatively and individually and for our patients.
And Peggy, do you recall what was the first major thing that got the attention? A lot of efforts, a lot of collaboration here, and people coming together to get their voice heard. What was the first or most profound shot across the bow that got to the governor or the legislature to make them start listening?
Yeah, well, I don't know if it got them to start listening, but we, as a law firm with some of the preeminent 340B experts, including many of you know Bill Von Osen, who is my personal hero in the 340B space, when we brought this to him, he said, we need to write a letter. And it was a very substantive, technical letter that said, this is why this is a huge problem. We also cited a national study that Mark mentioned earlier that we did for RWC 340B pretty extensively, in that letter, if I'm recalling correctly, to say this is the harm you're going to do to the HIV/AIDS population by a carve out, and also talked, at least at that time, about the federal implications, that this is a federal program that we felt that no state should be undermining. And that is really the bottom line, I think, of all these carve out fights, at least to me and to some of our other legal experts in my firm, is why should we be allowing states to take away the benefit to the safety net and to the patients in their communities of a federal program? It just doesn't make any sense.
Peggy, if I can say, first of all, you know, you deserve a lot of credit, because after, on the night of March 31st to April 1st, Michael and I got absolutely no sleep and start sending pleading text messages to you saying, oh my God, this is the worst possible thing. You've got to help us. And Peggy went to Bill and immediately, you know, and then we went to our executive committee, and everyone recognized that we needed to get involved immediately, that 1 year was going to fly by. And we, you know, no day could be wasted. So give yourself some credit, Peggy, for talking Mike and I off the ledge, if you will, first day.
Oh, thank you. Well, I also tend to write things out of legalese into governor and legislatureese, so I think I did a little bit of that too. So yeah, lots of friends, our friends at Chicane's, Perry, I have to mention Perry became a fair bit of a media darling. We'll get there in a minute, but so did Mark and Mike. There was some great earned and paid media, again, that we'll talk about on the next slide. So I think
how about we talk for a minute just really about the grassroots effort, right? We hear about the organizations coming together. How did you all and who and how to determine what other people could help shake this up and get some movement from a grassroots level. Kimberly, I'm sure you had, I know you had some
Had a
good.
lot to do with it. Yeah. I would say you meet, when you're doing grassroots work, you meet people where they are. And that is the litmus test for any kind of grassroots work. And there are different organizations with different strengths, different networks, different tools, whether it was social media or bringing in some grass tops, as we like to call them, the higher level people who are influencers to the legislature or the governor. And so using all of those different gifts that people in the coalition were able to bring to the table made for, I think, what doesn't sound like a coordinated campaign, but absolutely was coordinated because we were playing to everybody's strengths. And I think so many different groups, I wish I could announce them all to you, contributed mightily to this effort. In fact, you might want to look at the Save the New York Safety Net website. There is a list of everybody who contributed, and I'm apologizing to all of them who we forgot to mention. So thank you all. Kimberly, anything else? We'll get to lobbying in a minute and how we coordinated that, but.
Yeah, no, I think that's, I mean, you covered it. Just to say that it was very much a total coalition effort, and that we made a decision, we're going to talk about media in a minute, but to hire an outside media consultant. One of the things that we did when we made that hire was to kind of put everybody under this bigger tent of the New York Save New York Safety Net 340B Saves Lives Coalition, and really to try to message this issue in a broader kind of way. And so there were lots of different kinds of organizations, and we were able to attract not just the HIV service providers, but some of the other, clinics and the Planned Parenthood and all that, and then also eventually get some support from prominent civic leaders and civil rights leaders like Reverend Kirsten John Foy, who helped us towards the end of the year. So it was an effort that everybody did contribute mightily, and we all kind of brought our different skills. And it was interesting also because we are in a pandemic, and we couldn't do our advocacy in the normal kind of way. So we all sort of really flexed all of our virtual social media muscles. I don't think I've ever written as many or edited as many sign-on letters as we have over the last the year. We did a lot of sign-on letters. So it was sort of a grassroots virtual, but ultimately pretty effective campaign.
I mean, the list goes on and on. There were town hall meetings, there were protests, there were grass tops, there was grassroots, there was earned media. I think kind of the only thing we didn't do in this campaign was paid media. And maybe somebody did that, but yeah, just about every tool in the toolbox, if you will, that it goes into a strong coordinated campaign was used here. So I think we're ready for the next slide.
I add one thing on.
Yeah.
You know what? Volume matters because, when you're throwing all these things out there, they're not all going to stick. So we had to do a lot, hoping that, if we can get 10% to stick, that was great. Yeah, more than 10% to stick. I think everything we did was strategic enough that it got to the audience we needed it to get to, but volume was important. So as much as you can do, hoping that one or two or three or four will get through to where you're trying to get through to it. I think that really is another story to tell that really paid dividends.
While we're talking about that, sorry, while we're talking about that, Mike and Mark, do you mind commenting on the upstate downstate dynamic? I think that is particular to New York, but not strange for other states. They may have rural areas, they may have city areas. How did you play that in this campaign to make it work?
Well, I mean, I think with Trillium being in Rochester and Evergreen in Buffalo, the Western New York region, we knew that the governor was a bit sensitive to those regions, you know, and I don't think it's just because the Bills were, you know, making the playoffs. Like, he's very sensitive to you know, the populations we serve. Of course, Kathy Hochul, the lieutenant governor, is from Western New York. So we thought, you know, we certainly, you know, aligning ourselves with, if you will, the powerhouses of downstate, the Callan Lords and the Housing Works, you know, and the sensitivity that the administration had to Western New York, that it would put us in a pretty good position if we all were able to align ourselves with the same messaging.
Mark or Kimberly, anything to add on that?
Yeah, I just wanted to give a shout out. You mentioned Perry earlier. I mean, we really sort of benefited from the creativity of some of our members in terms of the grassroots actions. Perry and Housing Works put together a car rally that took place around World AIDS Day and stopped traffic in front of the governor's executive mansion in Albany. And, you know, there was at least one other time just more recently where we did some in-person rallying with some cool props. So it was difficult to be in this sort of virtual environment, but we definitely, you know, got creative and tried to sort of make our voices heard in that way as well. And
Yeah,
with the town halls in addition to that.
Yeah, Kimberly, go ahead, Mark.
I'm sorry. Tag onto that and kind of brings it back to what you really first said, right? Was the upstate, downstate. I mean, we did have demonstrations in one day all across New York. It got media coverage in all the cities of all of these events, coordinated, although we couldn't all be together, right? But coordinated from New York all the way up around through to Buffalo. And that was awesome. That showed there was a big reach on this issue across the entire state.
So that reminds me, why were we so mad during World AIDS Day? What happened? Kimberly?
World AIDS Day, the governor issued a statement, you know, talking about how we've bent the curve and all our successes, which of course we want to celebrate. But in that press statement, publicized the reinvestment pool. I guess what, you know, was going to be this $100 million going back into the 340B covered fees. And so, full stop, we sort of decided that that was the point to really sort of make our voices heard. And it was kind of interesting because right before that point, the group was challenged and a little bit struggling with like what strategy to use. Do we continue on the road and try to reverse the carve out? Do we at one point Assemblymember Gottfried and Senator Rivera drafted legislation that would delay the carve out for 3 years just for 340B covered entities. Do we go that route? Do we come up with some alternatives? And so we were struggling and not really feeling like there was a clear path forward. And then the governor came out with this statement, and that sort of everybody came together. We had a united enemy again, and unleashed, you know, 2 town halls. One was called Countdown to Crisis. The other was called Enough is Enough. We did those rallies. We did a sign-on letter. We got some press. We really let them have it around that time.
Yeah, and I think go ahead, Mark.
Okay, we did within a couple of hours of the governor's press release being done. RWC 340B basically replied and retorted saying, "Yeah, no, this is not true, bad idea," which was terrific. And that's another lesson for our friends across the country. Don't be afraid to reply and do it quickly. Don't give them any comfortable time on the stage, if you will.
Mm-hmm.
Well,
I
that
think
goes,
that's,
go
I'm
ahead.
sorry.
No, go ahead.
I was just going to say that's a really important point, especially if you think about the last year, the political context. You know, New York is a really progressive state, or supposed to be a really progressive state, and we're right in the middle of a pandemic. Of course, the racial equity component was also, you know, gaining traction. And here we had a policy that was going to have the worst impact on, you know, traditionally marginalized and underserved populations. So you couldn't really, everybody was supposed to be really vigilant about, the pandemic and, of course, racial equity and diversity, but then you had this policy that was doing the complete opposite of that. And I feel like that really gave us some steam to stand up, especially when the World AIDS Day announcement came out, which I thought was totally really disingenuous. It really kind of lit a fire under us, and it sort of put us on the trajectory that we were going to fight this, to the end.
Well, and I was just going to say that rolls right into the next slide if we move along on the activities and lessons learned and some of the tools that you guys were able to use and bring to the table to make some wave here and get them ultimately to pause this for 2 years. And maybe you can talk about, you started to talk about it, Kimberly, you did, and Mark, but some of the tools you used in your toolbox to help fight this.
Yeah, I would just start us off by saying that we had Kimberly led our lobbying group, that I was the national lobbyist, but we actually had paid lobbyists through a couple of different resources, including Trillium and Evergreen's lobbyists who and others who were on those weekly calls. And what they would do is sit down and talk about which state legislators needed attention and education and who you were talking to and what, bills we were advancing or not advancing. And so it was that coordination of lobbying strategy, I think, was also really essential. Most state legislatures I've found up until about a year ago couldn't spell 340B. And I mean that not picking on state legislatures, but because they didn't have to. They didn't have to know what 340B was because it rarely popped up in their states. And really just in the last year, whether it's the carve out or prohibitions on discriminatory reimbursement, which we're thrilled to see taking off the way they're taking off, state legislators didn't have to know about 340B, and all of a sudden they did. So a lot of this was an education curve, a lesson for other states. Start educating them now, even if you don't have a carve out threat, even if you don't have a discriminatory reimbursement prohibition, start educating them now, because that will help you if and when that happens.
Hey, how about talk about,
Yeah,
go ahead, Kimberly, you're probably going to answer. Go ahead.
No, I was just going to add that this is also a place where I really want to give our primary care association Chicane's props. As Peggy mentioned, we were having regular weekly meetings of the legislative work group in addition to the full work group calls, and worked very closely with Chicane's and all of our various contracted lobbyists to make meetings. There was one of the lobbyists had set up a beautiful tracker grid, and we could each go in and say who we met with and when and what was the outcome, and we just sort of plugged away and probably we're all annoying each other, certainly just for trying to hold each other accountable in terms of having those meetings. Chicane's was able to, whenever there was an opportunity to testify or submit comments, they would often create the templates, and we would honestly just sort of plagiarize their templates and share it with our Save the New York Safety Nets groups to get those, get everybody involved and everybody's sort of constituents involved in the lobbying and advocacy.
And in terms of platforms, social media, websites, town hall meetings, how is all of that collaborated? And is there one area where you thought it was most impactful to get the story of 340B and the carve out, or was it a collective, all the platforms were collectively important?
I would just tell a tidbit of what I thought was cool is when we had a large meeting and it was at town hall and a couple of legislators showed up and just were on the call and started talking about how they cared. In my world and federal advocacy, that doesn't happen. And I thought it was pretty cool. And these are people who were saying, hey, we're with you. We heard about your town hall and we want to support you. I may be misremembering that, Kimberly, but that's something I thought was pretty neat. Yep.
Yeah, I'd say everything was impacted, right? So I think, maybe some of the op-eds or the press releases is what got the legislators to come to that town hall. I mean, in its totality, we got the result that we got. I'm hard pressed to point one thing and say, yeah, maybe we didn't need to do that, because I think we needed to do all of it to keep drawing attention. I mean, for a whole year, had to keep this, the attention on this with a group that usually has a very short attention span, right? So, yeah, I'd say it was all of the above. If we had to do it again, it would be the same.
No,
Yeah,
I completely agree.
The volume is important, right? So Mike, go ahead. I'm sorry.
Go ahead,
No,
Mike.
I just said I completely agree with Kim and Mark. Like every time it was always, we were doing something. There was always some next new media push, whether it was a press release, a letter, a social media blitz. I mean, there was always something. As soon as you finished one thing for a year, you were on to the next thing. Like what are you going to put out next? What's coming down the pipeline? And I think that we all did, again, with the coordination, endless Zooms and emails, but there was always something coming out, that was, that I think kept the pressure up.
And I would say of all of those things and agree with that, but the one I thought was really important is when we finally honed the message on communities of color, Black and brown communities, and how we've all known this. I think we all just assume everybody else understands that the safety net tends to be caring for those in minority communities. And then we started to say it out loud and everybody else started scratching their head going, and why are we harming these communities right now in the middle of COVID? And then it all came home. I think that's when it really sunk in to a lot of those legislators, as I understand in particular.
Yeah, one message that was powerful was because towards the end, this was when we were rolling out the vaccines, right? And so I'm saying, you're going to take resources away from, you're asking us to get the vaccines into these communities, and yet you're taking away what is, for many of us, the primary source of revenue to be able to do this. I mean, that's nonsensical, and I think that became a profoundly powerful argument, and showed the executive branch being somewhat disingenuous by saying, do this, but we're going to take these resources away.
Mm-hmm. Well, my pharmacist on the phone, Mark and Mike, can you describe, I think in layman's language, so why the carve out, the movement from, for one kind of payment system to a different kind of payment system, why does that change 340B? Why don't you get the benefit anymore when you move out of managed care to fee for service?
Let me take a mic. Yeah, it's because it's by statute. So if the state Medicaid is paying for the claim by statute, they have access to the rebate ahead of the covered entity having access to the 340 discount. Now, there is a way for the covered entity to still access the 340B price for those claims. And in New York, we can do that, but we are obligated to sell it to the state at the 340B acquisition price plus all dispensing. So in essence, the margin that is 340B that's always intended to stretch scarce federal resources on both the law, that margin's gone if it's Medicaid fee for service that's paying for the claim.
There's also, Bill reminds me of this on the regular, is that the part of the reason that managed care makes sense for the pharmacy benefit is the coordination of care and making sure that there is already built-in systems for trying to keep costs reasonable or down, right? And that if you have a pharmacy benefit that is managed one way and you have a medical benefit that is managed a different way, how is that coordinated? Care. So that's a point that came up in the earlier debates on carve-out. This is not the first year carve-out has come up. There's been a number of other states who have done something along the lines of carve-out, and a couple of them have what I think are odd permutations of carve-out. And ultimately, I think this could be challenged at the federal level, is that some states are, I think, abusing this modest privilege of, having a form of a carve out when they're undermining the 340B program. So that leads us into, I think, the conversation about suing the state. So there were not only one, but two organizations who were looking at lawsuits. So before we got what we got at the end of the day, which is a 2-year delay, we knew the only tool that we hadn't used in the toolbox yet was litigation or the threat of litigation. So simultaneously, two different groups, and I'll let you all speak to this in a minute, put together ideas for this is what we would put in litigation if we were going to sue. And my firm, Bill, again, happened to work on, was asked to work on and did a great job of producing the legal research about federal law and federal law on carve-out and what was meant to happen, what Congress's intent is supposed to be on how carve-outs are supposed to work. And I think the bottom line of all of that is nobody in Congress ever imagined that the 3 or 4 laws that are related to 340B were ever meant to decimate the 340B program and let the states do that. So that research, I think, was helpful to both of those pending, or not pending, but proposed pieces of litigation that we didn't have to file, but we have in our little pockets right now in case something else comes up. Mark, I know you were involved in this, and Kimberly too. Is there any, and Mike, is there anything you want to add in this space? Starting maybe with Mark.
Yeah, I would just say that the research that Bill did found I think, a pearl for us. I think there is a pathway for litigation to get this once and for all stopped for all states. And a lot of the data that we collected, we actually used to respond to the state's waiver request, to kind of put it out there to say, look, this is still here. I know it's only a 2-year delay. It hasn't been reversed. And so, by the way, we have a compelling case. Here it is. This is why CMS would deny the waiver request, but also New York State, there's something here that I think there is a here that can help us years from now if we need to get to litigation. And so we shared what we had and what Bill found, that pearl that Bill found, specific to the Affordable Care Act and what he believes is the intent of Congress. And we're sharing that with our friends because they are already considering litigation out there, but actually they've already started a suit, I believe, and we're trying to give them this information. Maybe they can beat this out there before we have to.
Right. Mike, did you want to add?
No, I think Mark did a great job of summarizing. I think, RWC 340B and Powers working to get this research to, I think one of the first strategies was an intent to sue letter, was just to sort of, put the state on warning a little bit. But as far as actually building, we had to build the substance on the back end of that. And I do think that, to Mark's point, that the research that was done does show that there is an actual credible way forward with the intent of the program.
What I'm also finding kind of fun lately is that the Department of Justice and HHS in the various federal, if you will, litigation on the contract pharmacy issues are dynamite. Maybe I'm a boring legal geek and I read motions to the court, but what I'm noticing are some fabulous pearls in how the Department of Justice and this administration is talking about the importance and the power and the need for the 340B program that I've never seen before. So pulling from what HHS is doing around the country in a variety of states is also a tip I would give to you, is look at some of those motions, because there's some great arguments that are in those motions. Also, I'll tell you, I was fascinated this week when I heard from our Florida friends who said there was a carve out in Florida and it was pulled. And the reason it was pulled is because the head of their health department, I apologize, I don't know the actual title, but a woman stood up in a hearing who runs that health department and said, do you understand that a carve out would harm the safety net who we're trying to protect? You aren't saving money if you're hurting the safety net. And that was game over in Florida. So at least for now, I'm thrilled to hear that there was somebody who understood at the state health department level what we've been saying for a year, and finally got the New York legislature to understand.
Well, Peggy, it looks like we only have a few minutes left, so I'm not sure if we should go to the next slide and try to fit in one more question.
Yeah, I forgot we had one last slide. Thanks. So what do we do next? We're working busily and having those meetings that Kimberly described and sketching out plans for, can we work with the state to save them money in a different way? Maybe not on the back of the 340B providers. We don't want to go shooting at our states all over the place. Let's try to work with them, certainly, but not on the backs of the 340B providers. So we are in detailed discussions and technical discussions about where we go from here. We only have a 2-year delay, so we've got a limited amount of time in New York to try to do something that's going to work for everybody in the state, not the least of whom are the safety net providers in the communities we serve. Anyone else want to add to that? I just tried to summarize that real quickly for all.
That's perfect, Peg. I think I'll just say is that, you know, there was advocacy for the past year to at least get it stopped, to give us some time to come up with a solution. And now it's policy. Now we're developing policy that's going to, that's going to answer the concerns of all the stakeholders. And then there's going to be advocacy again. So once we get to develop a policy that we think works, protects the safety net, but still giving the state some savings, then we're going to have to go and start doing the advocacy to get the legislature to support it, and perhaps, include it in the next budget.
Great. And Kimberly mentioned the group is sticking together and keeping close on this. So know that RWC, 340B, and Save the New York Safety Net are going to continue to talk to each other and hopefully do more to prevent any of this harm we're talking about. And with today's webinar, we hope this is part of our education of you all. And if you need more information, there's a couple of really great places to go. I've already mentioned the New York Safety Net, Save the New York Safety Net website. Also, RWC 340B's website under the advocacy portion. We're getting a new website, by the way, so it'll be much cuter in a couple weeks. And then the third is CV 340B, our two sponsor hosts of this webinar today. CV is, again, a grassroots advocacy organization where if you want to write a petition or sign on to a petition or write a letter to the editor or contact a policymaker saying protect the 340B program, CV makes that really easy for you to do.
Great. Thanks, Peggy. Thanks, Kimberly, Mark, Mike. Your efforts truly worked, and we all thank you for your hard work in New York, and I'm sure it's going to have a big impact nationally, but more to come. You guys are wonderful. Stay safe, stay healthy, and thanks truly everyone for joining us today. We hope to do this again and share more lessons learned.